Good day. My name is Glenn Pierce. I'm a member of the ISTH Gene Therapy Working Group, and I'm here to talk about a poster that was presented at the EHAD meeting 2024 in Frankfurt, Germany in February. It's the 7-year follow-up of valoctocogene roxaparvovec gene therapy for hemophilia A. Emily Symington is the lead author, and I should point out that I'm also a co-author on this poster. This is one of a number of reports on the follow-up of the patients from the original phase 1/2 study. If one looks at the overall schematic from figure 1, one can see that patients received a B domain deleted factor VIII construct in an AAV5 capsid. Intravenously, it went to the liver, where a liver-specific promoter has resulted in the production of measurable factor VIII. There were 2 dose cohorts in this group, a 6E13 and a 4E13 vector genome per kilogram dose cohort that produced measurable results. I want to turn first to the sustained reduction in the annualized bleeding rate. And what we can see here, looking at the y-axis, is the annualized bleeding rate. And looking at the x-axis is years, year 1 through year 7 for the 6E13 cohort, and year 1 through year 6 for the 4E13 cohort. You can see, looking at the blue bars, which are means, that the annualized bleeding rate remains very low in the 6E13 cohort, and is low until year 6 in the 4E13 cohort. And there's a particular patient in year 6 that can account for that. Looking at the annualized factor VIII infusion rate, we see that it has also remained relatively low. Blue bars are means. But there have been infusions in these patients for various reasons, either bleeding or surgical procedures, for instance. One particular patient at year 7 went back onto prophylaxis. Actually, 2 patients in year 7 went back onto prophylaxis, which increased the annualized bleeding rate for the 6E13 cohort. For the 4E13 cohort, the bleeding rate has gone, the infusion rate has gone up a little bit in year 6 to 3.5, and that's due to a patient having repeated bleeds in his ankle, but he did not wish to return to prophylaxis. Looking at the slope, there has been a year-over-year decrease in activity in both of these 2 cohorts, the 6E13 and the 4E13 cohort, but it appears to be decreasing in its diminishing slope as we move into year 6 and year 7. And so it may be starting to level off at this point, albeit at relatively low levels. Figure 6 looks at the individual factor VIII activity by chromogenic assay. This is not including patients who have gone back onto prophylaxis. We can see one patient, his activity is remaining within the normal range at the end of year 7. The other patients are primarily in the mild to moderate ranges, with one patient less than 1.5 IU per deciliter. In the 4E13 cohort, patients have trended downward over the 6 years of follow-up here. 3 of these patients are mild at year 6, 2 are moderate, and 1 was lost to follow-up but was moderate when he was lost. With regard to safety, there were no new treatment-related severe adverse events. There was 1 internal carotid artery bleed in a patient in the 6E13 cohort, accounting for the large increase in factor VIII infusions within this cohort. As I mentioned, in the 4E13 cohort, there was a series of 15 treated ankle bleeds in 1 participant who had elected not to go back onto prophylaxis. Overall, though, safety was good. The patients are doing well. For the most part, are having low bleeding, although they continue to have relatively lower factor levels than when they started in the study. Thank you for your attention.